The 60-vote threshold having been achieved, the bill is passed.
An almost unheard-of unanimous vote in the Senate to advance the legislation to the House of Representatives in the hopes of getting it to the President's desk for signature before the end of the week. It would send payments of $1,200 to Americans earning up to $75,000 a year, with a gradual decrease in amounts offered to people earning up to $99,000 annually. An additional $500 will be paid for each child. It expands jobless benefits even for freelancers or gig workers like Uber drivers. Extends a $350 billion loan facility to small businesses and a $500 billion lending program to distressed companies. In addition, it provides a Marshall Plan of over $100 billion for hospitals and frontline health workers who are fighting the pandemic, among other measures.
I'm proud to announce tonight not a single senator voted against this $2 trillion rescue bill to save American individuals, small businesses, large businesses, and to provide considerable funding for the healthcare workers and the scientists and the doctors and others who are trying to solve this pandemic. So I think if I were writing your headline, I'd say the Senate has pivoted from one of the most contentious, partisan periods in the nation's history to passing this rescue package 100-0, all in one quarter of this year.
This as hospitals in New York buckle under the crush of new patients, with Elmhurst Hospital Center in the borough of Queens losing 13 patients in one day. A refrigerated truck stationed outside to hold the bodies of the dead. These nurses at Mount Sinai West in Manhattan wear black plastic trash bags fashioned into makeshift protective garb as personal protective equipment remains in short supply.
Most impacted states, we're 30,000. Next closest state is New Jersey at 3, California 2. This is a really dramatic differential, and this is what I argue to anyone who will listen. We have 10 times the problem that the next state has, which is New Jersey. You compare us to California, which is larger in terms of population. We have 15 times the problem.
You want me to get you into this political mess?
As one of the leading doctors fighting this pandemic suggested, the novel coronavirus could return seasonally, much like the flu.
The reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us and what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle.
A stark warning to countries gearing up for the winter months.
Dr. Fauci also tempered expectations that the US economy would return to business as usual as early as Easter in the middle of April next month. Speaking on a local cable news channel, he said, quote, "You don't make the timeline, the virus makes the timeline, and you've got to go with the situation on the ground." Sherman Bryceby's SABC News, New York.